Hi, and welcome back. I'm Darryl, and welcome to McCullagh Therapy. And in this bite size, we're going to continue a series about ADHD. And in this podcast specifically, we're going to be looking at the types of therapy for ADHD. So medication is typically one of the kind of go-to approaches for adults and children dealing with attention deficit or hyperactivity disorders. However, for those who want extra support or don't want to take medication, ADHD therapies can help manage their condition. Whether you're looking for concrete steps to take and skills to learn, or more insight-orientated therapy to learn how some of your habits affect your life, relationships, there is a type of therapy for you. So to go over very quickly, ADHD is a form of neurodivergence characterised by hyperactivity, impulsivity and inattention. It is not a character flaw. Medications are one of the most popular and effective ways to manage ADHD characteristics, but there's also ADHD therapies that can be helpful. Types of therapies you might consider include cognitive behavioural therapy, mindfulness-based cognitive therapy, dialectical behavioural therapy, ADHD coaching, maybe supportive psychotherapy, hypnotherapy and others. The type that is right for you depends on your needs and your goals. So let's start off with the types of ADHD. There's three main types of ADHD, but however, treatment for most of them is largely similar. So the first one's ADHD, impulsive or hyperactive type. This is the least common form of ADHD. This type is characterised by the impulsive and hyperactive behaviours with no inattention or distractibility. And then we have ADHD inattentive and distractive type. And symptoms of this type generally include inattention, distractibility without the hyperactivity. And then we have ADHD combined type. And this type is the most common. It's a mixture of impulsive, hyperactive behaviours with inattention and distractibility. So the types of therapy for ADHD. There's many kinds of therapy for ADHD, though some of the methods may vary between children and adults. Types of therapy used to treat ADHD range from dialectical behavioural therapy to mindfulness-based cognitive therapy, as I said before. Treatment for adults with ADHD will look a little different than treatment for children with ADHD. A lot of the kind of children's therapy for ADHD will involve things like their teachers or parents or maybe even both. But we're not going to focus on that in today's podcast. So the first type of therapy I'm going to look at is cognitive behavioural therapy, or CBT. Cognitive behavioural therapy is generally considered the kind of gold standard for ADHD psychotherapy. While regular CBT may be helpful for ADHD, there's also specific types of CBT for ADHD. And this can help with improving daily life struggles such as procrastination, time management struggles, poor planning. CBT helps people find new coping strategies and the emotions and behaviours that interfere with implementing strategies. The CBT for ADHD model is organised kind of around three modules, and there's also two optional ones. The three kind of modules are psychoeducation and helping with organisation and planning, and coping with distractibility and adaptive thinking. And there's also optional ones, as I was saying, which will be things like addressing the procrastination, involvement with maybe a partner or a spouse to help. And then we have mindfulness-based cognitive therapy. And research has shown that this type of therapy may be helpful because of how medication and mindfulness affect the brain and the neuropsychiatry. The benefits are things like reducing mind wandering, daydreaming, distractibility by improving the function of the default mode network in the brain, which modulates attention. Helps with things like learning to observe emotional states, emotional regulation, improve executive functioning. Then we have dialectical behavioural therapy. Dialectical behavioural therapy is another form of therapy often used for people with ADHD. This type of therapy is focused on teaching people skills to deal with ADHD And again, it's based around the following modules of mindfulness, emotional regulation, interpersonal effectiveness, distress tolerance, impulsivity, hyperactivity, and attention. Its efficiency is proven by the fact that the control patients, while they're on the waiting list, tended to have really worsening troubles with attention and hyperactivity, whilst they're actually waiting for that treatment. However, those receiving the treatment fared a lot better. And then we have ADHD coaching. Now, it's not technically psychotherapy. ADHD coaching is gaining popularity as a ways of managing symptoms and quality of life for people with ADHD. There's no standardized kind of protocol. This type of coaching usually involves goal setting, homeworks, discussing successes and roadblocks, problem solving. Coaches use text messages, emails, phone call, reminders to help clients meet their goals. People are often encouraged to use self-rewards or rewards from the coaches or others. And then we have supported psychotherapy. It's a form of therapy that helps clients optimize the coping skills that they already have, so that these strategies can be used to reduce stress, manage symptoms such as time management and organisation. And this type of therapy is very much patient driven. It's symptom focused and it's measurable, such as planning to control your anxiety or manage coursework, for example. And then we have interpersonal therapies. This is typically employed to address issues that may have developed between, let's say, a client and others due to the misunderstandings about their ADHD symptoms. Things like their forgetfulness or procrastination that are affecting those that are in their life or maybe in their work life. And one key feature of this type of therapy is that the therapist may use it to help the client see the difference between their inner experience and how their behaviours affect others. This type of therapy may also address personal issues such as a sense of failure, low self-esteem, that often stem from the challenges people with ADHD traits can experience, those trying to fit into society's neurotypical expectations. We also have group therapy. And this can be helpful for people with ADHD to learn from other people dealing with the similar kind of types of challenges that they have. Help them overcome those challenges. A specific type of group therapy for ADHD-I, which is the inattentive type, is called CBT ADHD-I, and it teaches group members planning, how to start activities and end activities, lifestyle changes, and how to troubleshoot where they have issues in these areas. It combines applying the techniques in the in-person sessions and homeworks outside of the groups. Mindfulness meditation is also practiced to help the group members reduce stress and improve attention regulation. And I'm going to finish off talking about narrative therapy. Narrative therapy has been found to be helpful for people with ADHD to help reduce that kind of self-stigma they may experience. Many people with ADHD tell themselves that they are lazy or underachieving, leading them to wonder what the purpose of trying really is, and thus becoming a self-fulfilling prophecy. Narrative therapy can help people with ADHD externalize their issues. So the lack of attention becomes the problem rather than I am the problem. And this type of therapy can also help people identify the sparkling moments when things are different from the stories. They tell themselves so they can see their strengths rather than their challenges. There was a study done of school-aged girls who participated in narrative therapy, and they found improvement in their school performance following the therapy because they identified and replaced negative self-beliefs. The narrative therapy helped increase their ability to see that they could find their own solutions to problems without having to rely on others. So hopefully you've seen some kind of insight into this. Maybe you got a wee bit more learning or knowledge for yourself. Thank you for listening. I want you to have a great week. Bye bye.